to go through some NCLEX questions. It's like a game. Here's the question. Do you know the answer? Here we go. If you need to study for mental health, study with me. Because I haven't had a lot of time to talk about what I'm doing in school or to show you, I want to study with you. So my next class coming up that starts next week is mental health. It is, I think, a 6-week class. And I'm just going to make some videos. We're going to go through some NCLEX questions. I have the Lippincotts Q&A review for the NCLEX RN 10th edition. I don't know what year this is, guys, but I'm going to do 10 questions. And I'm not a professor. I don't know the right answers. But this is a great way to study. I have found listening to people read the NCLEX questions and talk through the answers really helps me remember them. So Nexus Nursing is a YouTube channel that I like to listen to her. And her voice is memorable, which helps me. But also just the style of hearing someone talk through the answers makes it more memorable. And I like the whole, it's like a game. Here's the question. Do you know the answer? So I'm going to make these videos 10 questions, 10, and they're going to be mental health because that's what I'm, getting ready to do. And I want this to benefit me too. So here we go. If you need to study for mental health, study with me. Question number 1. The nurse is planning care with a Mexican-American client who is diagnosed with depression. The client believes in mal ojo, the evil eye, and uses treatment by a root healer. The nurse should do which of the following? This is a cultural question then. Avoid talking to the client about the root healer. That sounds like the wrong answer. Like you shouldn't avoid a subject. Explain to the client that Western medicine has scientific, not mystical basis. That sounds kind of condescending. 3, explain that such beliefs are superstitious and should be forgotten. That sounds kind of rude. 4, involve the root healer in a consultation with the client, physician, and nurse. I'm wondering if that's possible. That's the one that sounds the most right. Let's read the answer. The answers, including the root healer, gives credibility and respect to the client's cultural beliefs. Avoiding talking about the healer demonstrates either ignorance or disregard for the client's cultural values. Negative comparison of root healing with Western medicine not only denigrates the client's beliefs, but are likely to alienate him or her and cause them to end treatment. That was an easy one, I think, guys. But I wouldn't have known that the root healer would be open to consulting with the other doctors. Number 2, after a period of unsuccessful treatment with Elavil, which the generic name is amitriptyline, a woman diagnosed with depression is switched to Parnate or tranylcypromine. Might be saying these wrong. Usually meds are pronounced about like they look though. Which statement by the client indicates the client understands the side effects of Parnate? So if you don't know the side effects of this, you're not going to know the answer. I do not know the side effects of this. It's a depression med though, so let's read. I need to increase my intake of sodium. I think we have to do that with lithium. I don't think most meds you would need to. I must refrain from strenuous exercise. That seems unlikely because exercise is good for you. You wouldn't want to take a medicine for depression that limited exercise. I must refrain from eating aged cheese or yeast products. I think aged cheese can interact with some medications. That's sounding possible. 4, I should decrease my intake of foods containing sugar. I mean, who shouldn't decrease their intake of foods containing sugar? I'm going to go with 3. It sounds the most suspicious. Let's see. Number 2, the answer is 3. Cheese and yeast products contain tyramine, which the client should avoid to prevent negative interaction with Parnate, which is an MAO, monoamine oxidase inhibitor. Sodium will not interact with parnate, and neither exercise nor sugar needs to be limited. That was easy. 2 for 2 so far. All right. Question number 3. This one's written in blue. I'm not sure why. A client is scheduled for the first ECT treatment, electroconvulsive therapy treatment, in the morning. The client has been unable to sleep, but at 10 p.m. refused to take Restoril as the nurse suggested. The client is still unable to sleep at 11:15 p.m. In what order should the nurse do the following? Okay, so the person's anxious. They're supposed to get electric shock therapy in the morning. They can't sleep. Here's 4 things we can do. Sit quietly with the client. Encourage the use of Restoril. Offer use of MP3 player with relaxing music. Discuss specific concerns. What order should we do them in? They're all good things to do. 10 p.m. they did not want that medicine. 11:15. We're going to do all 4 of them, just in what order? I feel like offer the use of MP3 player with relaxing music. You're not going to offer that and then start talking with them because they're listening to relaxing music. So I feel like we need to discuss specific concerns before we offer the relaxing music. Maybe discuss specific concerns. Then encourage the use of Restoril. Then offer the MP3 player, and then sit quietly. I'm thinking I have this wrong, but I'm going to say discuss concerns, encourage the use of the medicine, offer the music, sit quietly with them. Let's see. Sit quietly with them is first. Wonder how long we sit with them. Then discuss specific concerns. Then offer the music. And last, encourage the use of the medicine. So I guess you're going to sit quietly with them to show you care. And then try to get them to open up, talk about it. Then you know they don't want to take the medicine. You're offering an alternative, the music. And then last, if the music doesn't work, hey, do you want to go back to the medicine? Let's see their rationale. The client is likely anxious about the procedure. The nurse should first spend time with the client and then discuss the client's concerns about the procedure. Next, the nurse could suggest the client listen to relaxing music. The use of the sleeping medication would only be considered as a last resort since it might interfere with the effectiveness of the seizure required for treatment. Interesting. Does ECT cause a seizure? I mean, maybe it does. It's like shocking your brain. Well, that's that one. I got that one all wrong, guys. All wrong. But, so they refused the med. My takeaway from that is try all those other things before re-encouraging the med. And you sit quietly with them before you discuss the concerns to show your support. Okay, number 4. So we're 2 out of 3 I got right. Number 4, the client is receiving 6 milligrams of selegiline. I don't know what that is, or selegiline. I've never heard of that. Transdermal system, which is also known as MSAM. Every 24 hours for major depression. The nurse should judge teaching about MSAM to be effective when the client makes which statement. Okay, teaching is effective. That means which of these statements is true. And I know nothing about MSAM. I haven't started mental health. I've now heard of this drug. I know since it says transdermal system that it's a sticker that goes on your skin. Okay, number 1, I need to avoid using the sauna at the gym. 2, I can cut the patch and use a smaller piece. 3, I need to wait until the next day to put on a new patch if it falls off. 4, I might gain at least 10 pounds from MSAM. Which one of those is effective teaching? That means which one of those is true? It means 3 of them are false. A lot of depression medicines cause weight gain. They're pills, so I'm gonna say it's probably not the gain 10 pounds. And at least 10 pounds. It's just kind of weird wording. I might gain at least 10 pounds. That doesn't sound right. I need to wait until the next day to put on a new patch if it falls off. I think it would depend on when it fell off. It sounds like it gets placed every 24 hours. I feel like if it fell off in the morning, to wait until the next morning might be a little too long. So I don't think that one's right. It's either one or two. I need to avoid using the sauna at the gym, or I can cut the patch and use a smaller piece. Raylan has an estradiol patch, and I know you can cut those because for a while her dose was 1.5 patches and we were allowed to cut them. So for sure some transdermal patches could be cut. The avoid using the sauna at the gym though, that could make you sweat. And the heat and the sweat, I think, could affect how the medication gets absorbed. So it's one or two. I'm going to guess one, that they need to avoid using the sauna at the gym. I bet these patches come in doses where normally you would just use a whole patch. So let's see, number 4. Seligin transdermal is the first transdermal MAOI. The client on MSAM needs to avoid exposing the application site to external sources of direct heat, such as saunas, heating lamps, electric blankets, heating pads, heated water beds, and prolonged direct sunlight because heat increases the amount of saligilin. I don't know how I said this medicine. That is absorbed, resulting in elevated serum levels of saligilin. Cutting the patch and using a smaller piece would result in a decreased amount of medication absorption, most likely leading to a worsening of the symptoms of depression. The client should apply a new patch as soon as possible if one falls off to ensure an adequate amount of medication absorption. MSAM is not associated with significant weight gain, although a weight gain of 1 to 2 pounds is possible. We got it right! 3 out of 4 right, guys. 3 out of 4 right. Okay, question 5. The client has been taking 30 milligrams of duloxetine hydrochloride, otherwise known as Cymbalta. I know I've seen the commercials for that. It's a depression med. Twice daily for 2 months because of depression and vague aches and pains. While interacting with the nurse, the client discloses a pattern of drinking a 6-pack of beer daily for the past 10 years to help with sleep. Wow. Check their liver enzymes. What should the nurse do first? Okay, there's 4 options. First means what's like the priority thing. So they could all be correct, but what's the priority thing? Number 1, refer the client to the dual diagnosis program at the clinic. So their dual diagnosis would be depression and alcoholism. 2, share the information at the next interdisciplinary treatment conference. There's no way that's like first thing you do is share it at a conference. 3, report the client's beer consumption to the physician. 4, teach the client relaxation exercises to perform before bedtime. What should you do first? I mean, they're there at the hospital or at the clinic already. I feel like it might be teach the client relaxation exercises to perform before bedtime. Definitely you want to report the beer consumption to the physician and maybe the dual diagnosis program, but I wonder if you have to want to treat your alcoholism before you would go to that program. Not sure. Let's see if I'm right. My guess is teach the client relaxation exercises. That would be what we do first. Let's see. 5. Oh, the nurse should report the client's beer consumption to the physician. Duloxetine should not be administered to a client with renal or hepatic insufficiency because the medication can elevate liver enzymes. Now, I will say, I did wonder, I didn't say it out loud, so you're going to be like, sure, you did. I did wonder if he could have, or she could have, that much beer on that medication. I just thought it still might be good to talk about relaxation techniques anyways. But I think their answer does make more sense. Okay. Because this medication can elevate liver enzymes and together with substantial alcohol use can cause liver injury. Referring the client to the dual diagnosis program, sharing information at the next interdisciplinary treatment conference, and teaching the client relaxation exercises are helpful interventions for the nurse to implement. However, reporting the findings to the physician is most important. Something interesting here. They asked what I should do first, but they wanted to know what was most important, more like first priority. And yeah, because it's dangerous, your first priority would be to let the doctor know so that another medication can be prescribed. I still feel like you could teach relaxation stuff and still talk to the doctor, but yeah, I'm wrong. Report it first. Okay, we got 3 out of 5 I've got right. Number 6, we're going to do 10 of these, okay, and see how it goes. Number 6, a client was admitted to the inpatient unit 3 days ago with a flat affect. Raylan has that a lot of times. It just means you're not very expressive. Psychomotor retardation. Retardation would mean a slowing. Psychomotor would mean thinking, maybe? Thinking slower. Anorexia, that means they're not hungry. It doesn't mean they have like an eating disorder, anorexia. It just means they're not eating enough, like it's affecting their appetite. They might not have body image issues. You can have anorexia, it just means your appetite's kind of gone away. Hopelessness and suicidal ideation. The physician prescribes 75 milligrams of venlafaxine extended release, which is also known as Effexor XR, to be given every morning. The client interacted minimally with the staff and spent most of the day in his room. As the nurse enters the unit at the beginning of the evening shift, the client is smiling and cheerfully greets the nurse. He appears to be relaxed and joins the group for community meeting before supper. What should the nurse interpret as the most likely cause of the client's behavior? Anytime someone who's very, very depressed, especially if they already have suicidal ideation, is suddenly cheerful and happy, it could be because they've decided they are going to go through with the suicide, because then it's kind of like, oh, I have a solution, and their problem isn't going to be there later because they've decided to end their problem by ending their life. So they could be happier. That is possible. Let's see what the answers are. What should the nurse interpret as the most likely cause? 1, the Effexor is helping the client's symptoms of depression significantly. So you're not going to see an effect that quick with a depression med. 2, the client's sudden improvement calls for close observation by the staff. I would agree with that. 3, the staff can decrease their observation of the client. Absolutely not. They're more at risk for suicide with that behavior probably. 4, the client is nearing discharge due to improvement of his symptoms. Definitely. Number 2, the client's sudden improvement calls for close observation by the staff. There's another reason, though, that they could be greatly improved. I don't know if it's going to say it's in the rationale, but one could be they're way more seriously decided to commit suicide. That can cheer you up. But the other thing could be they realize they're getting help. Like almost the placebo effect of getting the med, realizing where they are. It could be making a difference. So, number 6, what do they say? The client's sudden improvement and decrease in anxiety most likely indicates that the client is relieved because he has made a decision to kill himself and may now have the energy to complete the suicide. Symptoms of severe depression do not suddenly abate because most antidepressants work slowly and take 2 to 4 weeks to provide a maximum benefit. The client will improve slowly due to the medication. The sudden improvement in symptoms does not mean the client is nearing discharge, and decreasing observation of the client compromises the client's safety. Again, I would say it is also possible, although they are saying like a huge improvement because they were like really down. Also, it can be a little bit of, okay, I am getting help now. And you start to feel hope because you are realizing you're in a good place to get help. You're getting the medicine. You might have a little bit of placebo effect, but definitely you want to watch them closer. So that one is right. I don't know what I'm at for how many I've got right and wrong. Where are we at? Number 7. This is another blue one. Oh, it's select all that apply. A nurse is conducting an intake interview with an Asian American female who reports sadness physical and mental fatigue, anxiety, and sleep disturbance. Prior to the client's time with the physician, it is important for the nurse to obtain information about the client's use of which of the following. Select all that apply. So these are all things that could be affecting their mental health. Tea, herbal medicine, breathing exercise, massage, folk healer. So tea, caffeine can affect your mood, and there's all kinds of teas, like there's herbal teas. Definitely tea you want to know about. Herbal medication, yes, like St. John's wort, valerian root. There's a lot of herbs that can affect people's moods. So yeah, tea, herbal medicine, breathing exercises, they can affect your mood, but I would think only for the better. So that I wouldn't say that's like super urgent. Massage, that can affect your mood, but I think only for the better. A folk healer, I would say yes to the folk healer because they might be prescribing some stuff. So 1, 2, 5, tea, herbal medicine, folk healer. Let's see. Number 7. 1, 2, and 5. It is important for the nurse to obtain information about the client's use of tea, herbal medicine, and a folk healer because the information is critical to the safe prescription of psychotropic meds. Breathing exercises, massage, and acupuncture are also traditional therapies used by the Asian American population, but do not interfere with the use of medication. So it's good for them to use them, or it's not going to hurt them to use them, but it's not priority to get that information. The priority is the information that could interact negatively with the drugs. Number 8, let's see, I want to know how many I got right. I got number 1 right, about the evil eye. I got number 2 right, about not eating aged cheese with parnate. Got number 3 wrong about the order to do the person couldn't sleep before ECT. Got number 4 right about don't use the sauna with a transdermal patch. Number 5, I got wrong. We were supposed to talk to the doctor about the beer consumption first, priority because it could interfere with the med. Number 6, I got that right. That was about the increased affect. Number 7, I got that one right. Got 5 out of 7 right so far. Let's keep going. 8. We're going to do 3 more. The client is taking 50 milligrams of lamotrigine, which is also known as Lamictal. I know I've heard of Lamictal. Daily for bipolar depression. The client shows the nurse a rash on his arm. What should the nurse do? Report the rash to the physician. Explain that the rash is a temporary adverse effect. Give the client an ice pack for his arm. Question the client about recent sun exposure. I don't think it's give him an ice pack. Sun exposure, it could be that Lamictal makes your skin more sensitive to the sun. But, so then it would be, hey, have you been in the sun? You should be careful, use sunscreen. Rash is a temporary adverse effect. That's possible. Or the rash could be an allergic reaction and he needs a new med. It's either 1 or 4 is my guess. We're going to go with, I'm going to go with 4. I'm going to guess that it's sun exposure and that medicine aren't good together. I might be getting this one wrong. That's a big guess there. Let's see. 8 is the nurse should immediately report the rash to the physician because lamotrigine can cause Stevens-Johnson syndrome, a toxic epidermal necrolysis. The rash is not a temporary adverse effect. Giving the client an ice pack and questioning the client about recent sun exposure are irresponsible nursing actions because of the possible seriousness of the rash. Guys, I'm not a nurse yet because that was irresponsible of me. So, someone's taking Lamictal. They got a rash. Don't be irresponsible like me. Tell the doctor it could be Stevens-Johnson syndrome, which I've read a little bit about that. It's like just a bad medicine reaction thing. Okay, I like my answer to that. 2 more. 9. The nurse is reviewing the laboratory report with the client's lithium level taken that morning prior to administering the 5 p.m. dose of lithium. The lithium level is 1.8 Oh, MEQs per liter. I don't know what that word is. MEQs, micro somethings. I don't know. The nurse should administer the 5 p.m. dose of lithium, hold the 5 p.m. dose of lithium, give the client 8 ounces of water with the lithium, give the lithium after the client's supper. I'm pretty sure lithium has a very therapeutic range. So it's either going to be administer it or hold it. Giving water wouldn't make a big difference. Giving it after supper wouldn't make a big difference. I have no idea what lithium levels are supposed to be, though. This is 1.8. I'm just going to guess hold, eeny, meeny, miny, mo. It's either 1 or 2. Let's see if number 9 is to hold the lithium at level of 1.8. The nurse should hold. Yay! Good educated guess. The 5 p.m. dose of lithium, because a level 1.8 can cause adverse reactions, including, here's the reactions of too high of lithium, guys. Diarrhea, vomiting, drowsiness, muscle weakness, lack of coordination, which are early signs of lithium toxicity. The nurse should report the lithium level to the physician, including any symptoms of toxicity. Administering the 5 p.m. dose of lithium, giving the client lithium with water, or giving it after supper would result in an increase in the lithium level, thus increasing the risk of lithium toxicity. We are 6 out of 9. Okay, number 10, last one. I got a 6 out of 9 so far. A nurse is conducting a psychoeducational group for family members of clients hospitalized with depression. Which family member's statement indicates a need for additional teaching? That means which one of these statements, if a family member said, would you be like, uh-oh, I got to talk to them more? 1, my husband will slowly feel better as his medicine takes effect over the next 2 to 4 weeks. I feel like that is true. So we don't need to talk to them. 2, my wife will need to take her antidepressant medicine and go to group to stay well. That seems reasonable. Number 3, my son will only need outpatient appointments when he starts to feel depressed again. I mean, maybe, but maybe he needs inpatient treatments again. 4, my mother might need help with grocery shopping, cooking, and cleaning for a while. I'm going to go with 3. The person assuming their inpatient son will never need inpatient treatment again. That sounds wrong. So number 10, additional teaching is needed for the family member who states her son will only need to attend outpatient appointments when he starts to feel depressed again. Compliance with medication and outpatient follow-up are key in preventing relapse and rehospitalization. The statements expressing expectations of feeling better as medication takes effect, needing medicine and group therapy to stay well, needing help with grocery shopping, indicate the family's understanding of depression, medication, and follow-up care. Oh, okay. I didn't even understand. I got it right, but they're saying my son will only need to attend outpatient appointments when he starts to feel depressed again. They were saying he won't need medicine next time. That's why. But it was really clear to me just because the other 3 were obviously right. So I got 7 out of 10, 70%. It's a C- in regular school, but it's a D in nursing school because 78 is usually a C-. So haven't started mental health yet. I need to do a little better. How many did you get right? Did you get them all right? You get some of them right? Thanks for studying with me. I'm going to try to do 10 of these a day with you guys. So yeah, I hope you had fun. If you like this, I can make lots more videos like this. I know maybe this isn't everyone's kind of video, but if you're just interested in mental health, or if you're in nursing school, or if you think, I wonder how hard the NCLEX is. If you're just curious, I think it's kind of fun. It's a fun way to study. So thanks for studying with me, guys.